I'm Dr. Peter Orris. I'm a physician at the University of Illinois in Chicago. For the past decade, my work has focused on occupational and environmental medicine. Prior to that, I did 35 years of general internal medicine at Cook County Hospital. Our focus in occupational and environmental medicine is as a bridge between clinical and preventive medicine, and it examines how workplace and environmental exposures can lead to disease. Throughout my career, I've treated patients, developed policy recommendations, and worked with governments to address chemical hazards. I've also represented the American Public Health Association within the World Federation of Public Health Associations. This contributed to the development of global environmental policy, from negotiating treaties like the Stockholm Convention on Dioxins and the Minamata Convention on Mercury, where I had the pleasure of representing WFPHA during those negotiations. And it includes, of course, the current efforts for an international treaty on plastics aimed at reducing toxic and single-use plastics. A major focus of my work has been on engaging the health sector to lead by example, showing how sustainability can be achieved without compromising patient care. Over the past 25 years, I've attended several World Congresses on public health. They've always been incredibly enriching. I've met colleagues from diverse countries and disciplines. It has sparked new ideas and approaches, and that's why I'm especially excited about the upcoming Congress in Cape Town to learn with global peers and bring those insights back to my work at home. Well, the word would be learning. The Congress offers an unparalleled chance to learn about new scientific insights, innovative epidemiologic methods, and also environmental toxicologic methods, effective strategies for implementing public health policy in different political and cultural contexts so necessary in the modern world. Well, change is both on an individual basis and more generally on how we can function from within the United States on a public health platform. And it means building stronger international network, working with colleagues I can consult on how to advance progressive environmental and public health issues. In the US, of course, we're facing significant challenges, and some political leaders attempt to dismantle parts of our public health infrastructure. I'm eager to learn how others around the world have faced similar situations and have continued their public health education and implemented effective local policies despite these barriers. Over the past 25 years, I've seen public health become more globally integrated, and with the COVID-19 pandemic, it underscored how interconnected we all are on a global level. In Cape Town, I hope we'll reflect on what worked and what didn't work during the pandemic and identify better ways to prepare, warn, respond in the future, both through medical and non-medical interventions. At the same time, I'm looking forward to a renewed focus on chronic diseases linked to environmental hazards and how we can design equitable, sustainable traditions away from harmful practices such as reliance on fossil fuels. For me, addressing equity is a primary importance when we are projecting a public health approach, both environmentally and in the occupational sphere on a global level. For myself, I would like to meet new colleagues, bringing fresh ideas about how to better measure and respond to global health threats, especially those tied to environmental hazards. I'm particularly interested in how we can regulate the use of chemicals and ensure that as economies grow, human health remains a central consideration in the development of new products and technologies, in contrast to the last 50 or more years in the development of products with only as an afterthought looking at human health. as an issue related to these products. Well, health without borders is very important because, of course, that's the truth concerning public health issues now on a global scale. It doesn't respect the political borders that divide us in a variety of settings. And Health Without Borders captures the urgent truth. Our economic systems are global. Our use of resources is global. And the impact of these systems on our health is a global impact. Too often, developmental focuses on short-term profits, and it ignores environmental costs and sustainability. I particularly like Health Without Borders because it augurs up the tradition of Doctors Without Borders and their courage to confront the urgent public health problems on a global level. We urgently need stronger public health policy, globally and locally, to ensure that production, waste, and recycling are managed in ways that protect both people and the planet. We have just one Earth, and it's reaching its limits. I hope this Congress speaks boldly and sparks bold new thinking on how to create a truly sustainable global economy that prioritizes public health and views health of the planet and its peoples and other species as a one health issue. I hope this meeting will help us in public health serve as a key element in civil society to control the threat of nuclear weapons and end the aggressive and illegal wars that violate in the most fundamental ways the hopes of humanity. The United Nations and certainly all public health colleagues should be involved in this struggle as a primary responsibility that we have toward the health of the peoples of the world. And I would call on all in the global community to take what we've learned from both the pandemic and decades of environmental health research and turn it into action. We must strengthen policies that prevent and control pandemics while also confronting the chronic diseases caused by industrial pollution and toxic waste. The future of humankind, in fact, the future of the planet as a whole, depends on political courage at every level to protect health and the planet that we share. Thank you.